Nurse's Pocket Drug Guide 2008 is in its 4th edition, and it is an encyclopedic guidebook with some of the most common medications. Actually, there's 1,000 medications at least in each edition of the book, as well as herbs and natural supplements that patients may be taking. When we describe each drug, number one, we list it by generic name, and we cross-index it with the brand name, and we also provide the drug classification for each drug. Drugs can really be best remembered if you know the classification of the drugs. That will give you an idea of all of the drugs that's in the classification, the side effects, the adverse effects, the drug interactions. If you know the classification, you really can know what a drug in that classification is going to do for your patient. Again, we list the drug by its therapeutic or pharmacologic class. We discuss the amount of drug that you should give, the dosage, we discuss scheduling. We also look at drug-drug interactions. Many of our patients with multiple comorbidities take many more than one drug. Some of my patients can take up to 17 drugs. So obviously, depending on where they're metabolized, depending on what the contents are of the drug, there may be multiple reactions. I wrote this book for a number of reasons. One, as a nurse practitioner, I needed a very handy reference guide when I was prescribing drugs for my patients. When I prescribe drugs, it's not just drug A is for illness A. There are a number of drugs that can be for illness A. So how do you choose? Well, one of the ways you choose is by knowing comorbidities, looking at demographics of your patient, their nationality, their age, their ethnicity, that type of thing. So I needed something to help me quickly at the bedside if I needed to prescribe something without running back and looking up in a large reference book. As a nursing professor who teaches pharmacology, for years I've watched my students struggle with heavy, large reference books that took a lot of time to find the information that they needed. In these large reference books, it's not very concise data. Sometimes you had to go through 10, 15 pages to find exactly what you wanted. Not only did that take time, but a lot of time the nurse would be at the bedside, the nursing student would be at the bedside about to administer something, a medication, and realize they needed a little more information because they found that something changed in the patient profile. And what they would have to do at that point is secure the clinical site. If they had medications ready to give, they had to bring them back, lock them back up in a medication cart, go back to a centralized area and look up the information. With a handy little pocket-sized reference that they could pull out of a lab coat, they'd be able to look at it, look up the information right at the bedside, be able to take care of what they needed to take care of, and administer the medication.